Now let's look at EKG number 4. First rate. We've got 10 across the bottom times 6, so 10 beats in a minute, 10 beats in 10 seconds, so 60 beats a minute. Okay, next is the rhythm, and we do have something interesting going on here. We have two pacer spikes. We have an atrial pacer and we have a ventricular pacer. So the rhythm is coming from an external source, so our rhythm is paced. Now let's look at the axis. F is negative and 1 is positive. So if F is negative and 1 is positive, we're in this upper thing, so we got to look at 2, and 2 is negative. Let's actually zoom in on that so we can take a better look. So we said that F is negative and 1 is positive, right? And then, so we're in this area. So if we're on this side of the line, meaning in positive 2 direction, it would be normal. If we're on this side of the line, meaning the negative 2 direction, we would be in the left axis, and we saw that 2 was negative, so we're going to say left axis. So next, let's look at our intervals. And there is no P because it's not coming from the SA node, so PR is nothing. So we can look at the QRS next. And the QRS, let's look at this one, looks like it's, again, about 3 small boxes. So we can say that one is okay, so let's then go through our bisection method. Let's use these two here and this one and down the middle. And so the QTC is also okay. All right, so let's zoom back out here. So next we're going to look at our ST segments and our T waves. So let's again break them up into the right anatomical areas. So we got our inferior ones here, we just did the lateral ones, and finally the anteroseptal ones. And so now let's look at each one of these. Let's go laterally. Looks like the ST segments are good. This T wave may be pointing down. Over here, ST segments are good. This T wave is pointing up. Let's look at these lateral leads. Oh, something's wrong here. Okay, so look, we go across the base here. This ST segment is high. This one is high. This one is high. So we do have some ST elevations in these lateral leads. Let's look at the inferior leads. Okay, ST segments look about baseline. These have a weird shape, though, I'll say that. And this one also, the weird shape. So we'll say those look fairly okay. Oh, here we definitely have some ST elevation here. We have a T wave inversions here. So we have some anterior T wave inversions and ST elevations. So we look at the picture of the heart with the blood vessels here, right? We had some anterolateral type stuff, right? And that makes sense because this vessel might be the culprit vessel because it's kind of getting both of these areas here. So then I would call this a paced rhythm at 60 beats per minute with some lateral ST elevations. So I would say an anterolateral STEMI. And this person needs to go to the cath lab.